Hi everyone, welcome back to another edition in the Nico the Vet channel. I thought for today's topic of discussion we would talk about corneal ulcers or eye ulcers. Same thing, I may use the terms interchangeably, but what I mean is an ulcer on the surface of the eye. So also for the purposes of this talk, we're going to focus predominantly on dogs rather than on cats, because cats, there can be some significant differences. So the eyeball, what is the eyeball? The eyeball is literally a ball. So think of it as a sort of a spherical structure with some, so it's a ball all the way around with some structures on the inside. Typically what those structures are your iris, which is the colored part of your eye, and behind that the lens. So there's your eyeball, your iris sort of floats in there, opens and closes the pupil. If you imagine that slits the pupil, and then behind that is the lens, which sort of gets fatter and thinner, and then behind that is the back of the eye, the retina. So when we talk about eye ulcers, what we're talking about is the surface of the eye. So if you look at my eye for a moment, the colored part you see is the iris, and that's actually inside of the eye. And then the black dot you see in the middle of my iris isn't a black dot at all. It's a hole in the iris, and that's as it gets bigger and smaller, it allows more or less light to go through and cast the image on the back of the eye. So that's inside of the eye. The reason you see my iris so clearly is that overlying the iris, so again, if this is the iris and it's a ball, overlying the iris, this bit here, that is the cornea, which is the clear part of my eye, and that then leads into the sclera, which is the white part of my eye. So the cornea, if you wear contact lenses, that's where you put your contact lens. So when we talk about eye ulcers or corneal ulcers in dogs, we're referring specifically to this very clear part of the eye, which you almost don't see under normal circumstances because it's completely transparent, which is an engineering marvel, really. It consists of several layers. We'll go into the layers in a moment, and the fluid balance, the amount of fluid in those layers and the amount of blood supply in those layers is in such a perfectly fine balance that it is completely transparent. When something goes wrong with the eye, then is no longer transparent. It becomes red, it becomes inflamed, it can become blue, and in some cases even brown or black. So when we talk about an eye ulcer, what has happened? Really, you get variations on that theme. So an eye ulcer means that if the surface of the cornea has been damaged to a varying depth. So what are the layers of the cornea on the eye? Well, imagine the cornea is similar to, if you were building a cornea, you'd build it much the same way that you would build a patio out in your back garden, in the sense that if you were doing the patio, you would lay down a plastic membrane, and in the eye that's called Desmonds membrane, and that's on the inside, so that most internal aspect of the cornea. And then on top of the plastic sheeting, you would pour a layer of concrete or cement. In the eye, that's called the stroma, which sits on top of the Desmonds membrane. And then once your cement has gone off or your concrete's gone off, then on top of that you would put paving tiles or bricks or slabs or whatever you wanted, and think of those as cells. So again, in your eye, you've got a layer of cells. So just to recap, so you've got a plastic membrane, Desmonds membrane, then you've got a thick layer of cement or concrete on top of that, and then you've got the pavers or the slabs or the bricks on top, which are the cells. So all of that, of course, is very, very thin. The cell layer is about 20 cell layers thick. So when we say we've got a corneal ulcer, we mean we've got some damage to that surface. The damage may just go as deep as the bricks or the tiles, or it may go even deeper to the level of the stroma or the cement layer. And if it goes right down to that plastic membrane, Desmonds membrane, then the pressures in the eye will often make that membrane bulge outwards. And that's a big problem, because that's one cell layer thick. And if you just cough or sneeze or burp or get shunted or pushed or play or excited, any rise in internal pressures could make that burst. So back to the idea of just what is an eye ulcer. An eye ulcer means the surface of the cornea has been damaged to various depths, and that may be a traumatic event. You may have scratched the eye, so the dog ran after a ball through the hedge and came out with a scratch in the eye. We would call that an ulcer, even though technically it's a scratch. And then also you can get unknown causes where the dog just comes in and they're sort of pinching their eye shut. If you open the eye and look very carefully, you can sometimes see sort of raggedy edges of any shape you could imagine, of any size, affecting varying amounts of the surface of the eye. And again, we often don't know what those are. It could have been that there was just something in the dog's eye, or they had an eye infection, for example, and then they were scratching it themselves and scratched it. So mostly we never know what's caused the damage to the surface of the eye, and it doesn't massively influence what we're going to do about it. So the cause doesn't massively influence our response to it. So Once you have the ulcer, again, we would categorize that as a superficial ulcer, which means it's just through the cell layer or the brick layer, or you can get a mid-stromal ulcer or a stromal ulcer, and that means it goes to the cement layer underneath. And anything that affects just the cell layer, or probably down to the middle level of the cement layer, I would probably call that a superficial ulcer, and anything deeper than that you would call a deep ulcer. So superficial ulcers heal extremely quickly. Your eye heals very much like your mouth does. If you eat, I find typically eating loaves of French bread, and just eat that, somehow it just cuts the roof of my mouth to ribbons, and you can feel the sort of scratches in the roof of your mouth, and 2 or 3 days later that's all healed. So the eye should be exactly the same. So if you've had superficial damage to your eye, so just in the cell layer or just halfway through the stromal or cement layer, 2 or 3 days later, that should have healed. We facilitate the healing process by giving eye drops. The eye drops don't make you heal any more than if I cut my arm and you put a row of stitches in. The stitches don't make me heal. They just put the skin up against the other piece of skin, and then your body has to heal it. So the stitches don't make you heal. What they do is they put you in the best position to heal. So the eye drops for an eye ulcer are exactly the same. We generally give some sort of antibiotic eye drop, and the idea behind that is, again, it doesn't make it heal. The idea is it does 2 things. It stops bacteria infecting the ulcer, because think of, again, it's just also the equivalent of grazing your skin. The surface bacteria will often take advantage of that situation and colonize it, and then you've got an infected wound. So we give the antibiotics to stop an infection starting in the ulcer, because that will impair the healing process. And then also just by virtue of putting some sort of liquid or drop or ointment, or some of them are polymer gels, that has some sort of lubricating effect on the eye, which just helps it when the eyelid moves up and down. It makes it less painful. And pain is a very important thing to address in these guys too. The presenting symptom usually of a corneal ulcer will be your dog will come up to you like this, and the eye will be pinched tightly shut, and there may be a watering eye too, in the same way that if you hurt the surface of your eye. If you can't see the ulcer, and often you can't see the ulcer on the surface of the eye, your vet may not be able to see it either. Obviously, just looking at it under magnification, we've got little toys at our practices which help us look, and we may even put some fluorescein in, which is it's like an orangey liquid that we put in the eye, and if there's any damage to any part of the surface of the eye, it will stick to that and almost color it in as a bright sort of green. So it's peculiar. It goes in orange and it turns green. I'm sure there's a clever scientific reason for why that should be. Any healthy part of the cornea, it will not stick to that, and it'll drain out through the nose, because remember, you've got a duct, a nasolacrimal duct leading from your eye to your nose, which is why when you cry your nose runs. So when we put the eye drops in, the bit that if there's no ulcer, obviously nothing sticks to the surface of the eye, and it all either just flows out or comes out of the nose later on. Or if there is an ulcer, it'll colour in the ulcer and the rest will come through the nose. It's important to know that if it does come through the nose, it looks like something out of a B-grade horror movie. It's nothing to worry about. I've had people phone me and go, "Oh my God, what have you done? The dog's got green stuff coming out their nose." It's absolutely fine. It's a normal process. And in fact, we'd often do that deliberately to confirm that tear duct is not blocked. So shallow ulcers, you want to do the antibiotic eye drops, some painkillers. We give painkiller oral medication, so liquids or tablets to take, because it does bloody hurt. And thirdly, there's always the risk that the dog will rub it, and as they rub it, they impede the healing process. It's like having a graze on your arm again, and you sort of rub the graze all the time. Well, it can't heal. It's going to be difficult. So if that's happening, we'll put one of these awful Buster collars or Elizabethan collars. The cone of shame, I think, is the colloquialism. That will just stop the dog getting to it. So there's 3 tiers to that: antibiotics, drops, oral anti-inflammatory / painkillers, and then something to stop further damage. And that's appropriate for all your superficial ulcers, and they should heal in 72 hours, and that be the end of it. More problematic are the deeper ulcers, and that means obviously it goes through the cell layer, through the cement layer, and through most of the cement layer. That can happen in any breed of dog, but it does seem to be much more common in the brachycephalic breed. So the brachycephalic means anyone with a squashed nose. So boxers, bulldogs, Boston Terriers, pugs, Pekingeses, that kind of thing. They seem to just have a genetically predisposed, if you like, a condescending term, a substandard or poor quality corneas, which are very, very prone to ulceration and and they go medium to deep very, very quickly, and they're also very poor at healing. So in the veterinary world, we talk about brachycephalics particularly, but again, any breed, but the brachycephalics more than anybody else, will have indolent ulcers. So they have an ulcer, it could be shallow or deep, either or, which then just doesn't want to heal. So you do all the right things, and it just won't want to heal. So again, there's probably a genetic problem in these breeds where they just have poor healing capacity. So what do we do when we have an ulcer that won't heal? We address the reasons of why it won't heal. So first of all, there could be a problem with infection, so we definitely want to give these antibiotic drops, and there could be a problem with rubbing, so we definitely want to put a buster collar on them, and of course it's painful to varying degrees, so we tend to give you painkillers. So you've done everything right, and now it's clearly not a simple, uncomplicated superficial ulcer. It's either a brachycephalic breed who just wouldn't heal a superficial or a deep ulcer, or it's a deep ulcer. So what we do in those individuals is think of the healing process on the eye. Think of it as the cells. Think of them as tiles on your bathroom wall, and you need, if you've got damage to the surface of the eye, imagine someone's smashed off the tiles on your bathroom wall. So internal to the tiles in the back of the wall, you can still see the plaster on your wall, which is effectively the stroma. So what you want to do is you want to put new tiles on the wall, and that's the equivalent of the body trying to heal the ulcer by growing new tiles or new epithelial cells into the ulcer space to fill that ulcer space. So with these indolent ulcers that just won't heal, what's happening is the body's trying desperately to put new tiles into the ulcer, but they're just not sticking well. And we know that because when we check these guys a few days later and we put the fluorescein, the dye in there again, you can actually see where the ulcer is. You can see the ulcer there, and then around the ulcer you can see like a halo of green, so a strip of green all the way around. And what's going on there is the ulcer, if you imagine that's the ulcer there, it's trying to heal in, but the cells aren't sticking. So when you put the fluorescein in, it slides under there and then all the way around, which also gives you that halo effect around the ulcer. Now those cases are not just going to suddenly decide to heal. If those cells are not adhering, they're not going to adhere, and we need to interfere with them. So go back to the model of a bathroom wall. If you've put tiles on the wall and you use whatever it is that they use, I imagine there's some sort of grout or adhesive, or I'm not sure what it's called. Think of it as basically glue. If the tiles are being tiled back on the wall and the glue isn't working and the tiles are just falling off, well then you need to key the wall, and you'll see your bathroom decorators do that. They'll take a screwdriver or something metallic, and they'll literally just scratch across the surface of the wall by keying in, scratching deep grooves, and then they'll put the adhesive on, and that just gives it a key. It helps to stick, and that helps then to stick the tiles on more securely. So in the eye we do exactly the same. So we put a bit of local anesthetic in the eye so it doesn't hurt, and we just take a regular cotton bud that you would use to clear ears, wax out of your ears. Of course you shouldn't be using that, but everybody does. And all we do with the local anesthetic in the eye is we rub the eye. Now that halo of cells that are formed around the ulcer that are not adhered, those will just come away. Don't worry about when your vet does it. Don't worry that they're going to rip off healthy cells. Healthy cells will not come off when you rub it with a cotton bud. So we just rub quite vigorously. All the poorly adherent or non-adherent cells will just come away. And then on a microscopic level, the cotton bud, although it's a soft cotton wool, that has the effect of keying it. It does scratch the surface of the ulcer so that the glue, if you like, will work better at sticking the new cells down. And we would generally do that and review you again in a few days. If that doesn't work, if just scratching it with a cotton bud doesn't work, then you've got two options. One is what we call a keratectomy, and effectively, again, we're trying to key it. We're trying to scratch the surface, but slightly more of a scratch than you would get with a cotton bud. And the vets will take a needle, a normal needle that we would use to inject you with, and we hold it and just very lightly, if that's the cornea, we just drag the point of the needle across the cornea. We scratch, and then at 90 degrees to that, so you create like a hatch effect of scratches across the ulcer. You're obviously not going deep, we're just going deeper than the ulcer, if you like. So we're not trying to get right down to Desmonds membrane, that plastic membrane, and we're not even trying to get deep into the stroma. We're just trying to scratch the surface of it. Sometimes your vet will want to do that under anesthesia. Sometimes they'll be happy to do it under local anesthesia. The principle is the same. Scratch it, and that will let the adhesive work even better. You may be fortunate that your vet may have a burr, which is literally like it looks like a great big dental drill with a very blunt burr, so a spinning rough ball, and you can rub that on the surface of the eye, and that spinning rough ball sort of roughens up the surface of the eye and gets rid of all the dead cells too. So doing it with a needle or doing it with a burr is either way is absolutely fine. It depends on what your vet's got. And that will then encourage it to heal. And really 99%, once you've keyed it like that and you've roughened it all up, will heal as long as you carry on with the antibiotics, carry on with the painkillers, and absolutely carry on with that collar. Because if they're rubbing the eye, imagine the body is successfully now sticking new cells in the eye and they are adhering well and the glue is working and you've keyed it and everything's going well. Well, just like if you've done that in your bathroom and you put the tiles on, if you then wait, before the actual glue is set, before it's gone off, if you go in and rub the surface of the wall, obviously the tiles are just going to come off. So the same applies with your dog. Is as the new cells are sticking, as they are sticking, that's grand. Everything you've done has worked. But then if the dog rubs them before they've properly adhered, obviously it's all just going to come off and the ulcer is not going to heal. So the buster collar is absolutely paramount. I know nobody likes it. It'll destroy your shins. It destroys your architraves. The dogs don't like it. It's a disaster, but it's a necessary evil. And it's only in very rare cases, if you have an ulcer that just will not heal after you've done all the right things, or if you get an ulcer that becomes infected. They often call these melting ulcers. They can be pretty nasty in the sense that once you get an infection in the ulcer, the bacteria that cause the infection release enzymes which start dissolving this cornea, the surface of the eye, and it literally looks like sort of molten wax dripping off the eye as the surface of the cornea just turns into this horrible mushy wet drippy wax effect, and literally your cornea just sort of slides off the surface. Those will take much more aggressive treatment, along the same principles, but we're not going to go and scratch them. We will do everything that all the other stuff I've mentioned before, and a lot of times we'll actually even make an eye drop out of the dog's own blood, which is very clever for these melting ulcers. So effectively what we do is we draw some blood from the dog, spin it down. We don't want the blood cells, we just want the liquid part of the blood, the plasma or the serum, and then we take drops of that plasma and serum and use that drop in your eye. And it's very, very clever because obviously you're not going to react to it. It's your own tissues. It's very clever in what it does is it inactivates these proteolytic enzymes that the bacteria are releasing. So it stops them causing the melt on the ulcer, so that the eye can heal faster than it's being damaged by the infection. And that will solve those cases 9 times out of 10. But occasionally we'll get ulcers that go very, very deep, very quickly, down to Desmonds membrane. It's bulging out, it's not healing. There's every chance it's going to rupture. Those cases really do need to go see an ophthalmologist, and they'll do a very clever technique where they make a graft of your conjunctiva. So just to complicate the issue, going back to the anatomy of the eye, over the I've said the clear part of my eye that you see through to see the iris, that's the cornea. The white part, that's my sclera, and then obviously you've got my eyelids there. Now covering the sclera and covering the inside of my eyelid is the conjunctival membrane. So when people say they've got conjunctivitis, what they mean is the inflammation of that membrane. So under an operating microscope, they can raise a flap. Sort of imagine there's your conjunctiva. What they'll do is cut a bit loose like that, flip it around and stitch it onto the surface of the eye. So they get it from down there, bring it on, stitch it over the ulcer and stitch it all the way around, and that almost forms like a patch in the immediate term. So you've patched the ulcer so it can't shouldn't rupture because you've just put the patch on. And then it does another clever thing too. Remember we said that the cornea is so clear because it's got a very, very poor blood supply. Well, that's great because it's transparent and you can see through it all the time. But it's bad because when you have damage to the eye, one of the reasons that it may have a job healing is that there's just not enough blood supply to the ulcer. And remember, think of the blood as just sort of roads that allow lorries to come in and offload oxygen and glucose and protein and all the materials you may need to repair your ulcer. So if you simply just don't have enough access for the lorries to come in with all the repair materials to repair your ulcer, then it can't heal. So by putting the patch there, what the patch does is it immediately, with the patch that's coming across of conjunctiva, it brings all the blood vessels, so all the lorries can come in and offload the materials for repair. So very, very clever. And once that's happened, once that's healed, where it's attached to the rest of the eye, they just snip that bit off. The bit remains on the surface of your eye. You'll always have a little bit of a white dot on your eye, but it'll heal very well. And that goes back to also, if you have an ulcer that's not healing, provided it's not going very, very deep, how long do you wait before speaking to your vet about a referral to an ophthalmologist? And I would say, 4 to 6 weeks. I think probably more towards the 6-week mark. Just let it heal. And that's because when you've got this damage to the eye, let's say it's in the very, very dead center of my eye, new blood vessels have to grow in from the bit where you see the white and the colored bit join. Again, it's not the colored bit you're seeing, it's actually the cornea overlying it. But that bit of the white bit, the circle the white bit makes joining the colored bit is the limbus, and new blood vessels have to grow in from there into through the cornea, and get to the ulcer. Again, think of them as roads allowing the blood to come in, and then the lorries come in and offload the repair materials. That takes time. They grow at about 1 millimeter a week. So if you look at your dog, I went to a very interesting ophthalmology talk once where the ophthalmologist got up and said, everyone gets all freaked out about eyes. You don't have to remember much. He said, if there's yellow or green coming out of the eye, then it's infection and you need antibiotics. If it's blue, it's because there's inflammation, and then the blue comes from water logging in the cornea. Remember, the cornea normally has a very fine balance of fluid, so it's normally transparent. If it goes blue, then you've got water logging in there, so there's inflammation, so you need some anti-inflammatories. And if it's red, it's good, because red means there's inflammation, there's blood vessels growing in, they're bringing in the roads for the lorries to come in and bring the repair. So don't get freaked out about a red eye. That's a good thing. And in fact, we can look at how far these vessels have grown in. Again, they grow at about 1 to 2 millimeters a week. So you could look at that also and say, okay, you're in week 3 now, and I can see the vessels growing in, but they haven't quite reached the ulcer. So I'm not necessarily alarmed. The ulcer's not going deeper. It's not become infected. It's not a melting ulcer. My pain is well controlled. Then I'm just really waiting. I'm just waiting for those vessels to grow in more and more and more. And once they reach there, the healing will happen. And once the healing has happened, the vessels just drain away and collapse, and they become ghost vessels, meaning they're there, but there's no longer any blood in them. The vessels just collapse away and everything goes transparent again, and you don't see them. So the body is just a marvelous thing. So that's a snapshot then. That's eye ulcers in dogs in a nutshell. There's various other potions and lotions that are available on the market, but the broad principles of treatment remain the same. Thank you. Bye-bye.